Hello, my name is Carey Farquhar. I am a professor in global health, in medicine, in allergy infectious diseases specifically, and in epidemiology. And I am very pleased today to be able to speak with you about the internal medicine global health pathway, the rotation that we run in Naivasha, Kenya for residents, and also other opportunities to pursue global health during residency. UW residents have a strong interest in global health, and we recognize that in the departments of medicine and in global health. If you want to get more information about opportunities across the entire university, do take a look at the Department of Global Health website. There's a tab under training specifically for residents and fellows, but the entire website has information that I think you'll find of interest. Today, I'm going to focus in on the internal medicine global health pathway, as well as a few other opportunities specifically for residents or for immediately post-residency. So the pathway itself is open to 3 residents per year, and then a resident once entering as an intern participates during the entire 3-year residency program. The pathway includes the opportunity to take a course called Global Health Leadership for the Clinician that I lead with Dr. Monroe Wise. It's a 1-month course in the R2 year. Global Health Pathway residents also participate in an independent mentored project that is generally conducted abroad, but doesn't necessarily need to be. Pathway residents have 2 to 3 months that they can focus on this project, which is very valuable, particularly if you're able to travel. There's also a interdepartmental rotation that I'll talk a little bit more about later, and global health seminars and pathway meetings, specifically for the residents in the pathway. So let me tell you a little more about the Global Health Leadership for the Clinician course, which is designed to teach residents the skills necessary to become future leaders in global health. It takes place over the course of a month. It occurs in the morning so that afternoons are available for clinical work. And it involves both didactic sessions where faculty and others at the University of Washington and in the community are able to speak to residents about a variety of topics, and also involves site visits. So here we have a picture of a visit to the Bill and Melinda Gates Foundation. We visit PATH and other foundations, non-governmental and nonprofit organizations in our greater Seattle area. Mentored projects can take a variety of forms. They can either be more research-oriented, or they can focus on something more clinical, like a medical education project. And we highly recommend that these take place in sites where there's a strong University of Washington presence. Fortunately, University of Washington has a presence in many parts of the world where a resident could go and be very connected with site mentors who are on the ground and able to support a rich experience. So let me talk a little bit now about the Clinical Education Partnership Initiative, which is the rotation that I mentioned in Naivasha, Kenya. This is not restricted to pathway residents. It's open to non-pathway residents in internal medicine, as well as to residents in other departments, and to residents from the University of Nairobi. It's a collaborative endeavor with the University of Nairobi with a focus on clinical education. And I think one of the hallmark features is that we have a long-term commitment to capacity building for this program, which has been going on for a decade now. It's a collaboration with the University of Nairobi as well as with the Ministry of Health. This is a government hospital where we're working and building capacity. There's a focus on clinical education, as I mentioned, and it involves residents from multiple different departments. One of the most valuable features is that there's a global health chief resident, and I think this is quite unique to the internal medicine program here, that we have a chief resident who is physically located abroad and is able to teach interns, medical students, the equivalent of residents or medical officers at that hospital over the course of the 12 months with the support of residents from University of Washington programs. So there's consistency and a true demonstration of commitment there. We have University of Nairobi residents participating, so we try to pair our residents. If it's a radiology resident, paired with a radiology resident from University of Nairobi, internal medicine resident paired with an internal medicine resident. We rent a house there, so everyone is safely housed and transported to and from airport to Naivasha. The funding for the travel to Kenya is not included, and that is something certainly to note. But otherwise, we ensure that you have a safe and a very connected experience there. The hospital itself is a 245-bed hospital. There are 400 adult outpatient visits per month, high number of HIV visits daily as well. And Naivasha is located on the shores of Lake Naivasha, which is a tourist destination. Here we have 3 of our chief residents who are able to enjoy the many activities in the area. Here you can see Dr. Steinberg on the far right, bicycling through Hell's Gate National Park, which is right outside the hospital doors pretty much. And there are also opportunities to visit the lake and do a number of other fun activities there. Lastly, I'd like to close by speaking a little bit about the University of Washington Global and Rural Health Fellowship, which takes place both in Alaska and on the Pine Ridge Indian Reservation in South Dakota during the first year. During the second year, one has an opportunity to live abroad and can choose between 2 different pathways, the clinical educator pathway or the research pathway. This is open to internal medicine residency graduates, and we've been fortunate to have a number of internal medicine graduates participating from University of Washington as well as other schools. So a few final comments. The internal medicine global health pathway application process takes place over the fall. A mentor and a project need to be identified. Please set up a meeting with me if you're interested. My email is there. It's also on the first slide. The deadline for applications is early in January. And I greatly appreciate that for all of you to contact me. I can give you ideas with about whom to meet with and ideas about which projects might be a good fit for this. There are a number of Department of Global Health courses, seminars, and the Naivasha rotation, which are open to all residents, including those who are not in the pathway. The Naivasha chief position is also open to non-pathway residents. And finally, the University of Washington Global and Rural Health Fellowship is an option for anyone in the residency program once you've graduated from residency. So please reach out to me. Thank you very much for your attention and enjoy the rest of your visit.